The biggest challenge for people outside of the hospital or when they're leaving hospital tends to be those people, well, actually there's two groups I'll probably put them in. The first one is the first diagnosis. I'll use the example of somebody who's had a sudden heart attack. They've gone from maybe having a diagnosis of some high blood pressure, maybe not, to having an acute problem like a heart attack. And they've gone from taking maybe no medications or even 1 or 2 medications up to 6 or 7. That can be overwhelming for people, not to mention the change in the lifestyle. There's cardiac rehab that occurs afterwards. There is all the changes in lifestyle that are necessary after an important diagnosis like that. And diabetes is exactly the same way. You go from not necessarily feeling bad. You go into your doctor, he does an annual physical, he runs a blood test and says, oh, by the way, you're diabetic. That can be overwhelming for anybody, let alone somebody who's in their late 60s, early 70s, or even 80s for that matter. The discharge process from hospital is improving. There's no question about it. We've got situations now where there's teams involved, where we have pharmacists and nurses and doctors working together so that when people leave hospital, they're not inclined to come back.